Hi there, Ridgely Goldsboro here from Harding Szymanski, and I am joined today by Karen Schnell, the Director of Operations of our HSC Medical Billing and Consulting Division, to talk about CRNA billing. And CRNA stands for Certified Registered Nurse Anesthetist. So let's kick this off right away. Can a CRNA practice independently without an anesthesiologist?
A CRNA can practice independently without an anesthesiologist, but it is dependent on your state guidelines. So each state can choose if they want to opt out of requiring supervision or medical direction. Some states, like Kentucky and Kansas, have opted out, and other states, like Indiana and Illinois, still require it. But you also have to know your hospital bylaws, because if the hospital chooses that they require supervision, then you still have to follow the supervision in those hospitals.
What is medical direction?
Medical direction is the anesthesiologist oversees 2 to 4 cases that are performed by a CRNA. And in order for the anesthesiologist to bill medically directed, they have to perform 7 activities. Those activities that they have to perform the pre-anesthesia exam, the post-op care. They have to set the plan of care that the CRNA will be performing. They have to make sure that the CRNA is a qualified provider. They monitor the case at periodic intervals. They have to participate in the most demanding pieces of the procedure, including induction and emergence. And then they also have to remain physically available, except for short periods of time, short durations.
You mentioned that the anesthesiologist must be present in the immediate area except for short durations. So, how is short duration defined?
Short durations is basically the anesthesiologist performing those 7 activities. So, accepting the patient in for the next surgery, um, discharging the patient from the recovery room, monitoring an OB patient at short intervals, providing an epidural to a patient that is in labor pain. So basically, short durations of time, things that they can do quickly, and they'll be available for the CRNA if they need them in that other procedure.
Excellent. So, what is supervision?
Supervision does not require the 7 activities that medical direction does. It only requires the one of being immediately available. They have to be present in the same area where the CRNA is, and they have to be available in case they have to have hands on in the procedure with the CRNA. It can be performed by an anesthesiologist, but it can also be performed by the surgeon, because the surgeon's right there in the operating room with the CRNA. So they would be able to have hands on if they needed to at any given time.
How does the insurance company know which was performed?
In order to get the correct payment for the correct method by the insurance company, you have to append modifiers to let them know what method was used. So in the case of supervision, the CRNA would be the one to bill, and they would append the modifier QZ. This would let the insurance company know to pay based on supervision. They will pay the rate for a non-physician provider. Some insurance companies pay the same rate as they would for a physician, and some will reduce payment, maybe by 15%. If they perform medical direction, then both the CRNA and the anesthesiologist get to bill. The anesthesiologist would append the QK modifier, and the CRNA would append the QX modifier, and they would get paid 50%. The anesthesiologist would be paid 50% of the physician rate, and the CRNA would be paid 50% of the non-physician rate. And of course, again, depending on the payer, there may be a reduction for the non-physician rate.
Now, you mentioned that medical direction is 2 to 4 concurrent cases. So is one case just considered supervision?
No, you would just bill, you have to still append a modifier. You would bill just like you would for the QZ case, but it's not just considered supervision. You would append the QY modifier. Now, Medicare, they used to not recognize that modifier, but they do now, and they pay it the same as the QZ modifier. But some payers may not recognize that modifier. Indiana Medicaid is one of those that do not. So you need to know your payer guidelines on when you're billing for these services.
Thank you. Now, what if there are more than 5 cases?
So since it's 2 to 4 cases, if you have more than 4 cases, then you have to append a modifier AD. And that modifier will reduce reimbursement because the limit is 2 to 4. So what they do is they reduce the reimbursement to only 3 units, 3 base units, and they will not pay you for any time. Now, there is a stipulation that if you were present on any of those cases at induction, they will pay for one 15-minute time, but they will not just automatically pay that. You have to appeal the claim and show proof that you were present at induction in your documentation.
Wow. Thank you very much, Karen, for taking a complex topic, CRNA billing, and making sense out of it for all of us so that we know exactly what we're supposed to do and when. We deeply appreciate your expertise.